Hi, my name is Liz Clark, and for the interview project, I decided to talk to one of a close family friend of mine, and her name is Kelly Oakes. She's been a practicing RN for 23 years, and it's all been at Cincinnati Children's. In her own words, she says that evidence based practice is making decisions on nursing care based on clinical research and experience. She says that she's not sure if she learned about evidence based practice in her undergraduate nursing program. She likes to think so, but she's not 100% positive. And in what ways does she use evidence to guide her daily nursing practice? She said she works a lot with central lines, and the care that they do is all evidence based. Um, she said that she changes the caps and dressings on CVDI patients, which are cancer blood disease patients, once a week, but then on GI patients and other non CVDI kids, they change the cap twice a week and then the dressings once a week. She's also on a CLABSI, which is a central line acquired blood infections team. And right now they're working with evidence based practice with some of their patients using a chlorhexidine foam or wipes. And they're seeing if using this chlorhexidine foam daily will help decrease the central line infections, which is pretty cool. An example of evidence-based practice project on her unit, like stated before, she says that much of the evidence-based practice relates to the central line infections in the home care. She said that they do a lot with this because they are unsure about some of these homes that these kids are going back to, some of them being really clean and some of them being not so clean, that they rely a lot of the care within the parents of these kids and trying to teach them not to take any shortcuts and line cares so that the lines stay clean from infection. She said one of the big practices that changed recently was done on the scrub time on any lines, being central, PICC, or port lines. They now use a 15-second scrub on the top of the cap, a 15-second scrub around the sides of the cap, and then a 30-second air dry before entering the cap to flush or draw blood. She said that they used to only do a 30-second scrub on the top of the cap, but the cap on the sides have many grooves, and that they were finding out that the sides and the grooves weren't getting clean at all. So they changed that to the 15-second to the top and then the 15-second to the sides. And she said that it's very important for undergraduate nursing students to learn about evidence-based practice because it dictates your entire practice, she says. You need to know the reason you are doing certain important things like the cap scrub. And she just said she at least thinks that you need to know the basics of why you're doing something and what you are doing. And yeah, that's about it. I was very interested in what she's been doing because I haven't talked to her that much, and through this project I learned a lot about what she does, and I thought that was pretty awesome. Thanks.